Most nursing students make this one pain-related assumption, and it could make you miss an NCLEX question and hurt your patient. Let's break it down with 3 practice questions. A nurse is educating a client about using a patient-controlled analgesia, PCA, pump. Which statement by the client indicates a correct understanding of the device? A, I should press the button only when my pain becomes unbearable. B, the PCA pump can administer a continuous infusion even when I don't press the button. C, I can have someone else press the button for me if I'm asleep. Or D, the pump will limit the amount of medication I receive to prevent overdose. The correct answer to this question is D, the pump will limit the amount of medication I receive to prevent overdose. Let's talk about why this is correct so you can get it right on your test. In order to answer this question correctly, you need to know some normal things about a PCA pump. And some of the clues are in the name. It is patient-controlled analgesia. If you're not familiar with it yet, you can do a quick Google search or look it up in your textbook. But the idea is there will be a pain medication available via, but that pain medication does not administer unless the patient pushes a button on the pump. It's intended to give the patient more control over their pain medication, but to do it in a safe setting so that they don't receive too much or too little and their pain can be better controlled. Because research shows if the patient's pain is better controlled, their recovery is going to be better. A is incorrect because we do not want them to wait until the pain becomes unbearable. Pain is easier to manage when we can prevent it versus try to get it back under control. B is incorrect because the PCA pump does not administer continuously. It only administers a bolus, so a one-time dose, when they click the button. C is incorrect because of that key word, this is patient-controlled. We do not want other people pressing the button because they do not know the patient's level of pain. And if they're asleep, they're probably not in a lot of pain. In addition, these PCA pumps usually have narcotics like morphine in them. So C would be a safety issue because opioids, narcotics suppress the central nervous system. If you're already sleeping, that's a sign you might be sleepy from the medication. And if you continue getting more of it, it can further depress the CNS, central nervous system. And now we're having physiological symptoms and consequences. So do not let somebody else push your PCA pump. D is a surprisingly important thing to educate patients on, the fact that the pump will limit the amount of medication they receive to prevent overdose. Many patients are afraid of taking pain medications because of the social stigma of getting addicted or the fears of what it could do to their body. And it's important for them to recognize that even if they sat and pushed that button all day long, the machine is programmed to stop administering the medication if the dosage becomes too high or too frequent. So the patient should be educated to push the button anytime they need to without worry that they will accidentally overdose themselves. Question number 2. A nurse is caring for a client with chronic pain who frequently requests pain medication. The nurse feels frustrated and questions the client's need for medication. What is the best action for the nurse to take to manage potential bias against the client? A, limit the client's pain medication to prevent dependency. B, discuss the client's pain management plan with the healthcare provider. C, educate the client on non-pharmacological pain management techniques only. Or D, rely on personal judgment to determine the client's pain level. The correct answer to this question is B, discuss the client's pain management plan with the healthcare provider. This is a common bias, not just in healthcare and with nursing, but in the population in general, that people with chronic pain are simply medication seekers. And the difficulty is that sometimes there are people like that out there, but we can't always assume that somebody who is requesting pain medication is doing it because they are a medication seeker and not because they are legitimately in chronic pain. That is a bias you have to be very careful to guard against. Answer choice A is incorrect because that's not your job to limit the client's pain medication to prevent dependency. As a nurse, we need to make sure we're administering it in a safe way and monitoring for side effects, and also monitoring that their pain is controlled. Therefore, limiting the pain medication would not be appropriate. C is a good distractor because non-pharmacological pain management techniques are excellent, and we should try the least invasive measures to handle patient symptoms whenever we can. However, this keyword only makes this an incorrect answer because we should not limit their options away from pharmacological pain control methods either. D, rely on personal judgment to determine the client's pain level is incorrect because there is no way you can know what a patient is feeling. Different people present pain differently. Some people internalize pain and you will not see much outward sign that they are in pain. That does not mean they are not experiencing pain. However, option B is correct because clearly the current pain management program is not working for this client if they have to frequently request pain medicine. Therefore, it would totally be appropriate to talk to the healthcare provider to find a better course of action to help control this chronic pain on a more ongoing basis. Question number 3. A client with chronic back pain is interested in non-pharmacological methods to help manage their pain. Which of the following interventions should the nurse suggest? A. Bed rest to avoid exacerbating pain. B. Applying heat or cold packs as needed. C. Increasing daily caffeine intake. Or D. Ignoring the pain to build tolerance. The correct answer to this question is B. Applying heat or cold packs as needed. Let's talk this through so you understand how to get similar questions correct on your exam. A is incorrect because we do not want to encourage bed rest. That can lead to lots of other negative side effects, such as weakness, poor circulation, constipation, all the things that happen when we're not exercising. So while bed rest may avoid exacerbating the pain in the short term, it's going to really interfere with our life and have some other far-reaching negative consequences. Caffeine intake has nothing to do with pain management. And even though a lot of people in real life, I can think of some family members, like to ignore pain, thinking it will build tolerance, this is not true. Or while they may kind of get used to the pain, that does not help their quality of life. And there are things that can be done to help manage the pain. There is no benefit to ignoring it just to build a tolerance for the pain. B is a great non-pharmacological method because heat and cold has different effects on the muscle and the circulatory system around where the pain is happening. Heat relaxes muscles and encourages blood flow to the area. The warmth helps dilate the blood vessels, and then the cells responsible for repair that happen to travel through the blood in most cases can more easily get to that area. So heat packs can promote healing. Cold packs can also help with pain. If there is already inflammation in the area, cold packs are going to do the opposite of the heat packs. The cold packs are going to constrict the blood vessels so that less blood can flow to the area. This might not sound like a good thing, but in a situation where there's swelling or inflammation, it's a great thing because the swelling and inflammation is a sign that there's already a lot of fluid and body workers there trying to take care of the area to the point where there might be too much and there's not enough space for more, which can cause the tenderness that we often associate with inflammation. So we can slow down their arrival, which alleviates some of the pain. If nursing school questions ever leave you second guessing yourself, it's not because you don't study enough. It's because nobody's ever shown you how to study the right way so that you can think through the questions instead of just cross your fingers and hope you memorized the answer. Spoiler alert, you didn't. In my next video, I'm going to teach you my silver bullet study system, the only 4 steps you need to take when you are studying in nursing school to grow your confidence and learn to think like a nurse. I'll see you there.